Hi, everyone. Thank you so much for joining me today. My name is Jenny LaCross, and I'm a dual credentialed athletic trainer and physical therapist with my board specialty certification in pelvic health physical therapy. I'm also a PhD student at Texas Women's University in Dallas. It is my honor to share my academic and professional journey with you all today of how I moved between healthcare professions as well as practice settings. I hope you walk away from this presentation feeling more comfortable with the unknown if your passions happen to lead you there as mine have. Additionally, I hope it sparks curiosity and self-reflection regarding your own path. This is one of my all-time favorite quotes that I initially read in a John Maxwell book. I liked it so much that I wrote it on a sticky note and placed it on the bottom of my computer so I can look at it every day I come in my office. I had no idea who Max Dupree was until I was asked to do this presentation, so I did a little bit of research, and what I found was rather serendipitous. Max Dupree, a Michigan native, was a famous businessman, leader, and author. His father was the founder of an office furniture company, the same company Max would one day serve as its CEO and president. However, his path was not a straight one. He originally wanted to be a doctor, but while in school, World War II started, so he joined the military and the Army Medical Corps. While still in the Army, he continued his schooling, ultimately obtaining a bachelor's degree after his service ended. It wasn't until almost 15 years later that he began leading his family's company. I want to take this time with you all today to tell you a different story, a story that is still developing, a story about my choices and strategies in healthcare. While I cannot be certain if Max had planned all along to end up a famous businessman and CEO, I can tell you with the utmost certainty that where I currently find myself is well off the original path I had planned to go. Every good story needs a guide, so I offer you this map of my professional life as a summary of where we are going today. My path started in high school at John Burroughs School, a private, non-secular college preparatory institution. It sits on a remarkable 49-acre campus in one of the wealthiest suburbs of St. Louis and looks and feels more like a small college than a high school, with roughly 600 students. I received a phenomenal education that did exactly what the school claims, prepared me to attend and academically succeed in college. My interests at the time were in science and Spanish, which aligned with my desire to be a physician who is bilingual or a medical translator. It is imperative that I stop here and discuss how the factors of race, gender, class, and sexual orientation have intersected in my story to highlight how inequitable educational and professional opportunities in healthcare remain today. At the end of this story, I challenge you to take 5 minutes and reflect on how these determinants intersect in your own life, how this has shaped your path, and how you can use your station to actively improve equity in this space as you move forward, regardless of direction. I've had many advantages in my life. I'm a cisgendered white female from an upper middle class family. Both of my parents are in the medical profession. My father is an interventional cardiologist, and my mother is a geriatric nurse practitioner. They both highly value education, and so that was instilled upon me from home as well as at school. And while I worked in the restaurant industry all through high school, my parents have financially supported me through all of my academic endeavors. I don't have any disadvantages. This is also another huge thing to consider in your own life, but also as you listen to my own story. There were certain things that did not exist in my way or that weren't in my path that others that might have also grown up in St. Louis, they might have faced very different hurdles than I did. So at this point, I had to make some decisions. I got to the end of high school and I knew that I wanted to be a physician, as I mentioned earlier. So I had to decide, did I want to go along with what my school wanted, which they wanted their students to go to private, small private institutions or Ivy League schools, or did I want to follow the path that I had desired, which was to go to a large state school, specifically University of Michigan, because my mom is from Detroit. So I decided to apply to University of Michigan. I got accepted. And so my path then took me to Ann Arbor, Michigan. When I originally applied to Michigan, I didn't know what kinesiology was, so I had applied to the School of Literature, Science, and Arts. But when I went to my orientation the summer before my fall semester in 2007, I happened to be there with a lot of students who were in the School of Kinesiology. Like I said, I didn't even know what kinesiology was. So as I asked them more questions, I started to realize that I thought that one of the majors in the School of Kinesiology would align much better with my desires to be a physician than any of the programs within the College of the Literature, Science, and Arts. So I made the decision at orientation before I ever even started school that once I started, I was going to apply for a cross-campus transfer. So I did that, and after my first semester, I got accepted into the School of Kinesiology. And at this time, my desires to be a physician started to slowly fade as I decided that I wasn't sure if I really wanted the lifestyle. I talked to my dad about it very significantly. He worked very long hours, and he just said, make sure you really want to be a doctor if this is something you're going to pursue. I am not a math whiz, and so I was having a great challenge passing calculus. And so I decided I thought I would stay in healthcare, but I was going to take a different route. Within the School of Kinesiology, there were a couple different majors. And after looking at all of them, I decided that athletic training was the major for me because I'm a kinesthetic learner. And in athletic training, you take classes in the morning, then you have clinicals in the afternoon. So I could take the skills that I was learning in the lab and class in the morning and then go practice them in the afternoon. For athletic training specifically, it's the only major within kinesiology that requires you to apply. So I started taking classes. I applied to the athletic training program in the winter semester of my first year. They did interviews in that April, and I was accepted into athletic training. So here I just wanted to share some pictures with you. This was a picture of me of my friend Liz in our taping and bracing class. So this was my very first athletic training class. We took it while we were waiting to see if we got accepted to the program. And then once in the program, I rotated through many different sports. So I started at football with in-season football. And then I got to go to wrestling, softball, volleyball. I worked at a high school and in a clinic. But my final sport that I spent a year at, so my senior sport, was men's ice hockey. And I absolutely fell in love with it. While I was at ice hockey, I got the opportunity to attend many life-altering and once-in-a-lifetime events. So the first one was the Big Chill at the Big House on December 11th, 2010, where Michigan crushed Michigan State, I'm very proud to say. We went to the national championships that year. So this is a picture of us at the Frozen Four, where Michigan upset North Dakota, where we went on to the national championship. And unfortunately, we lost in double overtime to Minnesota Duluth, but it was still an incredible experience. Now, as I was going through school and doing athletic training, I also volunteered once a week for 3 years. I took my previous passion growing up of dancing, and I actually taught tap dancing at a nursing home and an assisted living facility. And these are two of the ladies that attended every single class that I taught for 3 years. This was such a rewarding experience because not only was I able to take what I was learning about movement principles and apply them in athletic training, I was able to use them in my dance class to help improve things like balance, strength, and coordination in these lovely women and the singular gentleman that took my class. So I graduated from the University of Michigan, and while I was in the end of my senior year, at this point, I kind of had to decide what was I going to do moving forward. And I should back up and say this actually started at the end of my junior year because I was trying to decide if I wanted to stay in athletic training or if I wanted to go into physical therapy. I decided to move more towards physical therapy because I particularly enjoyed the rehabilitation side of athletic training. And there were a couple other factors that led to this decision as well, but we're going to get to those in a second. But before we move forward, I want to come back to advantages and disadvantages that I had. And if we think back to that first advantages slide, none of those things have inherently changed. I was still a cisgendered white female from an upper middle class family. I still had financial support and just emotional support from my family. Disadvantages, I still had no disadvantages. So even though I was starting to carve my own path, it wasn't a path that I created by myself. I was starting from a very high equitable, or from a very high standpoint that was actually still very inequitable compared to some of my classmates and other people within the institution. Like I said, no disadvantages. So at this point, I kind of decided I was going to move into physical therapy. I applied to a lot of physical therapy programs, and it was deciding between two. I was deciding between Duke and Washington University in St. Louis. I ultimately decided on Washington University in St. Louis, which might seem like an easy choice because I'm from St. Louis. However, there were a lot of things to consider with this decision. So I had actually initially wanted to go to Duke because, as you've seen on my map and through my story so far, I like travels. I like to experience different things. But I am actually from a quote unquote WashU family. Both of my parents work for WashU, and ever since we were younger, either my twin brother or myself were somewhat expected to attend Washington University for some part of our education. My twin brother had no interest in healthcare at all, so that fell onto me. And so there was a high expectation once I got accepted from my family that I was going to come back to St. Louis. Additionally, my grandparents, whose health was ailing, lived in St. Louis, and my parents really needed my help to take care of them. So after much debate and consideration, I gave up my hopes of going to North Carolina temporarily, and I decided to go back to St. Louis. So once I got back to PT school, I had done athletic training, and I was pretty dead set that I was going to be a sports physical therapist. I was very gung-ho about this. I was going to go through PT school. I was going to do a residency in sports physical therapy, and I was going to become a board certified specialist in sports physical therapy. And so as I was moving through that first year, and we had to come upon our first clinicals, I was not as open-minded as I should have been. So what I decided to do when we were choosing our first clinicals is I applied to Johnson & Johnson Physical Therapy, the flagship location of the Institute of the Physical Arts Fellowship, because I wanted to grow my manual therapy skill set. But once I got there, the universe had different plans for me. So this is a picture actually of the drive that I took to work every day. One of my classmates' parents had a summer home in Steamboat Springs, and they were kind enough to let me stay there. And so I went in thinking I wanted to do manual therapy and learn manual therapy, which I did. But while I was there, it was not a pelvic health clinic, but I distinctly remember this was a pivotal moment in my life and in my career and in academia. And we had two patients come in. One was a woman that had urinary incontinence or leakage of urine, and one had dyspareunia or pain with intercourse. And I remember these women coming in for physical therapy. I didn't know anything about it. I didn't know physical therapy could treat it. And I was just perplexed. Why were these women here? What did they think we could do in physical therapy to help them? Not only was I confused, but I was heartbroken for them. The woman with incontinence was very, very young. She was in her late 30s, and she was telling us how she couldn't even go out with her friends or her kids because she was so embarrassed by how much she was leaking. And then the other woman had recently gotten married, and she couldn't have sex with her husband, and her husband was with her and yelling at her saying, "You don't love me. That's why you don't want to be intimate with me." And it really just got me thinking about, what does an activity of daily living really mean? And what does quality of life really mean? For all the athletes that I had worked with, quality of life was not being able to play their sport. And granted, at a D1 institution, there are scholarships and other things writing on that. And it was very rewarding to help them rehabilitate sports injuries and get back to playing. But as I watched these women at this clinic get better and be able to be intimate with their spouse and to be able to resume normal childcare activities or going to the movies with their friends, that hit on a very visceral level for me. And I thought, we need people in healthcare to help women with these things. Women are one of the populations that are highly underserved in healthcare. There isn't as much research done on women as in men, although that's definitely changing, and I hope I'm contributing to that change. And so it was really from this moment that I thought I need to learn more about women's health and pelvic health. I think I want to do this, but I'm not sure. So I was very lucky at WashU. We had a women's health professor who is very well known internationally, and she kind of took me under her wing, got to do some shadowing with her. And we actually had a very large women's health unit in my program, which I think is probably one of the only programs in the country where you spend a whole 6-week unit on women's and pelvic health topics. And I was completely sold. So for my final clinical, I ended up going to UNC Chapel Hill, and I did my 12-week clinical in women's and pelvic health with a residency trained clinician. So at that point, my path had completely shifted from what I thought was going to be sports physical therapy, and I was now dead set on the path of women's and pelvic health physical therapy. So let's break down my advantages and disadvantages. My advantages still have not changed, but now not only am I a cisgendered white female from an upper middle class family with financial and emotional support, I have now gained skills and knowledge from all of my experiences and from my mentors that are further propelling me forward to other opportunities. I continue to have no disadvantages. And I know I'm harping on this, but I think it's so important to recognize that I am not having to face any critical challenges. So I finished school, and I have to decide at this point, do I want to go and try to get a job and learn how to do more women's and pelvic health things by myself through courses, or do I want to pursue residency? And the biggest thing that affected this decision for me was I was blown away by my clinical instructor at my last clinical. And so I had asked her, are you this smart just because you're this smart? Or did you learn all of these skills and this clinical reasoning through your residency training? And she said, it was through my residency training. I highly recommend you do a residency. So I applied to residency, and I ended up getting accepted to the same program where she did her residency, which was University of Pittsburgh Medical Center, Centers for Rehab Services. So I want to back up in my story just a little bit. While I do not consider it a disadvantage now, at the time, it might have been considered by some to be a small disadvantage. But in December of my last year of PT school, I had a periacetabular osteotomy with a femoral osteoplasty, which is basically where they fracture your pelvis, they reshape your hip socket, and then they put in a bunch of screws to give you better coverage of your femoral head. They fixed the labral tears that I had, and then they shaved off the extra bone on my femur that was causing a lot of pain that I was having. As you can see in the far left picture, the screws sat a little bit closer to the surface than they do on most people. That caused an exquisite amount of pain for me. I wasn't really able to wear clothing at all. Anything that touched it felt like it was searing to me. And in addition to that, I ended up developing CRPS, or chronic regional pain syndrome, in my left leg, which was, again, in retrospect, it really helps to guide and lead to where I am today. But experiencing persistent pain for that long was a very life-altering experience for me. I ended up having the screws removed, which helped some. And then as I moved forward, I was very lucky that the CRPS resolved. It doesn't for a majority of people. But this was something that I was working through while I was in residency. But it also sparked my interest in hips, which is kind of where my research interests have taken me. But while I was in residency, I got an extensive amount of very individualized mentorship on all women's and pelvic health conditions. But it was really in residency that I started to see my path shift on maybe I didn't want to stay in clinical care forever. So when I was in residency, I got my first paper published where I was the first author. In residency, I got to use my dance background, and I worked with the Pittsburgh Ballet Theater. I got to work at their studio and work backstage providing show coverage. And really, this is where I started to develop my love of teaching. Our residency program partners with University of Pittsburgh's physical therapy program, and as a resident, you lab assist for the ortho series, and then you also provide guest lectures as well. And it was here that I really developed my passion for teaching and research and started to see that maybe clinical care was not going to be my direct course or my only course. So again, we come back to the advantages and disadvantages. All my advantages have stayed the same. At this point, my leg issues had resolved. I had an invigorated love for pelvic health. I had a newfound love for teaching and research and working with orthopedic patients that had lumbopelvic hip conditions. And I still had no advantages. But at this point, my path kind of came to a fork again. And at this point in my residency contract, I had two options. I could either stay for another year and essentially work off my time, or I could buy out of my contract and pay for my mentoring hours, which didn't seem optimal. But my fiance at the time was living in Texas. He is also an athletic trainer, and he was working at Texas Christian University. And so I had an opportunity there to start my own pelvic health program at a sports clinic, or I could stay at my residency site, which would have been a little bit more comfortable, and worked for another year. Well, I decided to move down to Texas, and I didn't start at Texas Women's University, but I did eventually end up there, and then I left, and then I came back. So when I moved down to Texas originally, I started at Texas Health Resources, specifically at Ben Hogan Sports Medicine, which is now Texas Health Sports Medicine. And I started and developed their sports rehabilitation and pelvic wellness service line. So I provided services that were women's and pelvic health related, but I also spent a lot of time treating hips. So post-operative hips, non-operative hips, hip pain, back pain, pelvic pain. So I really got to dive into orthopedics, and this is where I got to spend a lot of time in multidisciplinary collaboration, both with physicians and then within physical therapy, working with my sports and orthopedic colleagues. I also had the great pleasure of serving as a mentor to this young lady in the photo. Her name is Ola. Our clinic partnered with TCU Athletics, and the women's basketball team had a mentorship program set up to where each player was partnered with a mentor of the profession that they wanted to go into. And so she wanted to be a physical therapist. So I got to work with her, and it just reaffirmed for me how much I really love teaching and mentoring. And so at this point, I had taken my board certification exam, I got it back, and I passed. But I'm sure, like many of you, I didn't want to just pass. I wanted to pass with flying colors. And I had done that except in the area of pregnancy. And so at this point, I decided I needed to seek out more mentorship and more continuing education on pregnancy. And it just so happened that Valerie Bob, who is one of the renowned pregnancy physical therapists or physical therapists that treat women who are pregnant, lived in Texas, and she taught at Texas Women's University in their Women's Health Post-Professional program. So I ended up enrolling in that, and I started at Texas Women's University. It's a 4-class, 12-credit certificate program that covers all kinds of topics from women's and pelvic health. I specifically wanted it for pregnancy, but I got a ton out of the classes, and I had no intentions of moving forward with anything else there. I just wanted to learn more about pregnancy, and I did that. There was the caveat that if you ever decided to do a PhD, you could use those 12 credits towards your electives. And I just kind of ignored that. I finished the certificate program. My husband got a job at Oklahoma State, so we moved up to Stillwater, Oklahoma, where I started another pelvic health service line for an outpatient practice in Stillwater, and thought, you know what, I'm just going to find opportunities to guest lecture at programs in Oklahoma, and I'm going to keep working clinically until I had to have an emergency appendectomy. So that surgery was very rough for me. I ended up developing some complications, and I tore my obliques off of my rib cage, and I tore some costochondral cartilage, which rendered me incapable of working for a month. And during this month, I'd like to say that I had a quarter life crisis because I was a young 30-year-old healthy female, and now I wasn't able to work because I wasn't able to meet the lifting requirements of the job. What was going to happen to me as I got older if I started to have other health issues? I felt like I needed to have some other skill set or use my skills in a different and novel way that would allow me to continue to work and not be hindered by physical limitations. And so I started to think back to the PhD program, and I did a lot of self-reflection and a lot of journaling, and it just kept coming back. I loved research, I loved teaching. As I moved through my clinical practice, all of these questions had come up. I was seeing a lot of women after hip surgeries that when you really start talking to them, they start telling you that they're having urinary leakage, or they had it before surgery, but it was significantly worse after surgery and nobody was talking to them about it. And so as we worked through rehab and they got better, they would ask me, why is nobody screening me for this? Why is nobody asking me about this? Why are you the only one that's doing something? And so I went to the literature like a good clinician would, and there really isn't that much literature on it. So I thought, wow, I think this might be another way that I would be able to help the community and help women and better serve healthcare and help healthcare providers make better decisions and more specifically clinical decisions about this particular patient population. So I ended up reaching out to one of my professors in the certificate program who happened to be the head of the PhD program on the Dallas campus, and we talked about it. I had missed the deadline for applying, so she had suggested taking one of the classes as a non-degree student, seeing if I liked the class, how rigorous the class was, if I was able to manage it with my full-time clinic load, and then if I wanted to pursue the PhD, to apply in January to start in the next cohort. Well, long story short, I loved it. I applied, I got accepted, and I just finished all of my courses. I'm taking my qualifying exams this week and then hopefully moving into dissertation. So here I want to take a second to now jump to my research interests, because going all the way back to high school, thinking I was going to be a doctor and take a clinical path, coming into athletic training because of the clinical aspect of it, moving to physical therapy because I like the rehabilitation aspect of it, and then finally coming to the conclusion that I want to move more into academia because I'm very interested in research and how I can contribute to healthcare in a very different but meaningful way. I started research on knee injuries in ice hockey players when I was in college, and that was more so because a physician asked me if I'd be interested in helping him. I had no great desire to do research, but I thought, hey, this sounds like a cool opportunity. I'll try it. And now it moved first to urinary incontinence in women with hip pain across the lifespan. That has kind of been refined even more to a specific kind of urinary incontinence called stress urinary incontinence, which is leaking with laughing, coughing, sneezing, jumping, running, bending in young females with hip pain. Implications of that for pregnancy, birth, and long-term risk of incontinence, and then early intervention strategies to keep women active, because we know that exercise has a lot of cardiovascular and bone health benefits for women. It's helpful for weight and stress management, and then for socialization and well-being. I'm also interested in looking at this specifically from a translational research perspective. So not only just doing not true bench research, but not just answering the question, but answering it in a meaningful way that's applicable. And that's the clinician in me. If I'm doing research, then if I were going to use my research in the clinic, how would I use that research and how can I make it meaningful? And then I'm also interested in outcomes-based research for the same thing. If we do research, but it doesn't really yield the outcome that we're looking for clinically, clinicians are the ones that are really using the research. So it's important that we keep that in mind. And to that end, I was very blessed that I've actually partnered with a physician at UT Southwestern in Dallas. His name is Dr. Joel Wells. He's a hip preservation specialist who happened to do his fellowship training with the surgeon who did my surgery. and he has been wonderful in helping me to begin exploring these questions for my qualifying exams and hopefully moving on into my dissertation. So what's next? I've taken you through my personal story and my journey of my travels across the country and through my different professions and experiences. What's next? Well, I'm hoping to complete a postdoc in an area related to, but not directly physical therapy or athletic training, because I'm hoping to gain a different skill set to then apply to the areas that I'm very interested in. As we come to the end of my story, there are two additional points that I would like for you all to consider. First, I have been lucky enough, because of all of the advantages I was afforded, to move around the country. So I started in St. Louis, where I was born. I went to Michigan. Then I went back to St. Louis for WashU. I did a clinical in Steamboat Springs, Colorado, and Chapel Hill, North Carolina. I moved up to Pittsburgh for residency, then down to Texas for my post-professional certification and PhD. And now I currently find myself in Stillwater, Oklahoma, where I'm still working on my PhD. If you have the opportunity, I would encourage you to take it to travel and move around the country. Not only is it beneficial professionally to see how medical practice is vastly different in different parts of the country, but to also experience different regional, state, and city cultures. It is increasingly difficult to effectively fight for equity within a profession or within patient care if you stay in a singular place and fail to expose yourself to diverse experiences, people, and places. Second, we all stand on the shoulders of giants. Mentorship has been critical to my story, and I have been fortunate to work with some of the most brilliant minds. I would be remiss if I didn't include and thank them in this story. So as I've moved through my training, you can just see how my tree of mentors has perpetually grown. So I want to thank you all so much for sharing your time with me today. I would love to connect with any of you to discuss where you're at right now and where you see yourself going, or if you have questions about travel or any of the programs that I've been in, I'd love to chat with you and answer any of your questions. Email is the best way to get a hold of me. I am on Instagram, but I'm taking an Instagram hiatus right now, and then I'm on Facebook and LinkedIn. Now, go and take the next 5 minutes to complete my reflection challenge. Thank you.